So let's go back to this recent news. I want to talk about the data when it comes to these younger children and COVID vaccines. What do we know about this?
Yeah, I think it's a good question. Young kids usually do well with COVID. However, if they get sick, they can sure mess up a family vacation, and they can be what we call a vector, meaning they can get sick, spread it to sicker folks, or spread it to susceptible folks, parents, grandparents. So I'm all in favor of young kids getting vaccinated. I think it's good for them, it's good for the whole family.
Okay, so I personally feel like I've known, so anecdotally, like a dozen people who've tested positive for COVID just in the last week since we spoke. So are more people getting it now, or does it just happen to be the people who are around me? And then also, are they getting very sick, or are these cases that you're seeing relatively mild?
Sonia, for the past couple weeks, every week I see more cases than the week before. There's no question COVID's going up all over the place. We're not measuring now. Most folks do home tests. We don't even know how widespread it is, but it's all over the place. The good news, it's milder. We're not seeing hardly any bump in hospitalizations or deaths. So all these various strains going around right now, they're causing a lot of infection, but not a lot of serious illnesses.
Yeah, so I personally would like to get my fourth shot, maybe even this weekend, to try to avoid COVID altogether, because a lot of the doctors that I talk to say, look, at this point, you want to avoid COVID because you specifically want to avoid becoming a long hauler, because some of those symptoms, and I've done a series of stories on this, are not only uncomfortable and unpleasant, but they can last months or longer.
Yeah, we're seeing a lot more and more long haulers. They used to say it was more common in young folks. Now we're seeing a lot of it in older folks also. What people are talking about is this fatigue, some call it brain fog, trouble concentrating, trouble thinking, headaches, muscle aches, and shortness of breath, anxiety, depression. Some people have all of these, some just one, and it lasts for weeks or months after you've had COVID. We don't really know how to treat that right now. There's no specific treatment for that. It does tend to go away over time. Now, some folks have found, though, if you get a COVID vaccine, a booster, that'll also help with long hauler syndrome. So we're looking into that. But right now, you don't want to get COVID because you don't want to get the long hauler syndrome, which can be incapacitating.
Yeah, that's what I've heard from so many people in so many different ways as well. And like you said, no specific treatment. I know a lot of studies are being conducted and people are resorting to experimental treatments because they're so desperate for some relief. And to my knowledge, Dr. Winter, it doesn't really matter if you have mild COVID or not. Anyone can end up with these long hauler symptoms.
Yeah, that's true. Although the sicker folks are more likely to get this, actually. We're seeing more of those with long hauler. In fact, if you look at folks who have been very, very sick in the hospital ICU, about 3/4 of those will have long hauler syndrome. At least it's something that looks just like that. So the milder cases seem to do better, but anyone can get it. Sonia, you're right.
Okay, Dr. Winter, that is all the time we have with you today. Thank you. I'm so glad we got to chat. And again, sorry I missed you when you were here earlier. Hopefully we'll get to see each other next time.
Live TV, Sonia. Good to be with you. See you next week.
All right, sounds good. Thank you.